All right, dive it in today, folks. We're going deep on a bug, a really common one, too,
Yeah, super common.
called Helicobacter pylori. H. pylori for short.
Right.
Bet a lot of you have heard of it.
Oh, yeah, most people have.
But it's one of those things where maybe you've heard of it, but, you don't really know what it does.
Exactly.
It actually infects something like half the world's population.
Yeah, about half. Huge impact.
So this is going to be your, shortcut to understanding this.
Shortcut, yeah.
Really significant health issue.
Absolutely.
So what we've done is we've gone to the latest global guidelines,
We have.
and we're going to break down H. pylori.
Yeah, we're going to break it down.
So you can really quickly understand it without getting bogged down in all the details.
Yeah, I think that's important for a lot of people.
Right.
So we're looking at the World Gastroenterology Organization Global Guidelines.
That's a mouthful.
It is.
Global Guidelines on Helicobacter pylori.
That's the one.
These were published in May 2021. And these guidelines, they represent kind of a global consensus
That's right.
from all these experts all over the world
Huge effort.
about everything H. pylori.
Yeah.
And this was led by Peter Catalaris, Richard Hunt, and a ton of other people from all over,
Team.
really every continent.
Yeah.
So they looked at the natural history of the infection,
Mm-hmm.
like what it does in the body,
Yeah.
how it's spread,
Right.
diagnosis,
Yep.
treatment,
That's it.
in all sorts of different settings
All over the world, yeah.
and for different, resource levels.
Exactly.
One thing that is really cool about these guidelines is they use something called the cascades approach,
Right.
which is this idea that basically the strategies to manage H. pylori,
Yeah.
they need to be tailored to the local situation.
They do. Very much so.
So what works in one place might not work in another place.
Definitely.
So we have to take into account resources and all those sorts of things.
Makes sense.
Okay, so let's get started. So someone gets infected with H. pylori. What happens then? What's the typical course of this infection?
So once you get H. pylori,
Mhm.
in most cases, unless you treat it with antibiotics,
Okay.
it kind of hangs around for life.
For life?
Yeah, usually. Sometimes you get really rare instances where the body just gets rid of it on its own.
So your immune system just wipes it out.
Yeah, we call that auto-eradication.
Eradication.
It's not super common, but it happens.
Hmm.
And then we also sometimes see it in infants.
Okay.
They might have these sort of transient infections where it's there for a bit and then goes away.
It comes and goes.
Yeah.
So I guess what you're saying is, for the most part,
Yeah,
if you've got it and it's not treated,
right.
it's pretty much there to stay.
Pretty much, yeah.
Okay. What about, you treat it successfully in an adult? What are the chances of them getting it again?
Actually, reinfection after successful treatment is pretty uncommon. Whether you're in a high prevalence area or a low prevalence area, it's not super common to get it again.
So if someone does seem to get it again, though, after being treated, is that always a new infection? Or can it be the original one kind of coming back?
That's a great question. What looks like a new infection could actually be something called recrudescence.
Recrudescence.
Yeah, think of it like this, like a fire where you think you've put it out,
Okay.
But there are these little embers smoldering underneath and then it flares up again.
So it never really went away completely.
Yeah, maybe the first treatment didn't completely kill it off, just suppressed it to a level that tests couldn't pick up.
Sneaky.
Right, and then it just pops up again.
Okay.
And it's also important to remember that there are different types of H. pylori.
Different strains.
Yeah, strains. And they're not all created equal.
Okay.
Some are more aggressive than others.
They cause more problems.
Exactly. We call that virulence,
Very.
how good they are at causing disease. And that can differ from strain to strain. And then on top of that, you've got differences in people, right? Their individual makeup and environmental factors too.
Yeah.
So it's a complex interplay that leads to this infection presenting in all these different ways, causing different diseases.
Okay. So how does it spread then? How does this bug go from person to person?
Well, that's the million-dollar question, isn't it? We still don't have a definitive answer.
Really?
Yeah. Despite a lot of research, the exact mechanism is still a bit of a mystery. But, based on what we see in terms of disease patterns and by looking at the genetics of the bacteria, the evidence really points to person-to-person transmission,
Okay.
especially within families.
So close contact.
Yeah, seems to be the main culprit. And it looks like moms might play a big role in passing it to their kids.
So it's mom's fault again.
No, not necessarily fault, but yeah, it seems like moms are often involved.
Okay. So what's the likely route then? How does it actually get transmitted?
Well, the two most likely ways seem to be either gastro-oral, so going from the stomach to the mouth and then to another person, or oral-oral.
Or oral.
Yeah, so basically through saliva, or other oral contact.
I see.
The fecal-oral route, which you might think of with other gut bugs, doesn't seem to be as likely, at least in developed countries, places with good sanitation.
Okay.
And as for those other things like, contaminated water or food or pets
Okay.
or even flies, that's mostly speculation at this point. We don't have solid evidence.
Right.
A lot more research to be done there.
So it sounds like close contact, particularly in families, early on in life,
Yeah.
is the main suspect.
Yeah, that's the current thinking.
Okay, now you mentioned that the prevalence of H. pylori, like how common it is,
Right.
varies quite a lot.
Oh, yeah, it does.
So can you give us kind of a global snapshot?
So, yeah, like we said, around half the world's population is thought to be infected.
Okay.
But that actual number, the percentage of people infected at any given time, the prevalence?
Prevalence.
Yeah, it differs massively, not just from country to country,
Okay.
but even within the same country.
Oh, wow.
Sometimes even within the same city. Like if you look at Figure 1 in the guidelines,
Okay.
it really shows you that variation around the world.
Global variation.
Yeah, global variation. And to really illustrate that point, there's Figure 2.
Okay.
This comes from some research done in Kuala Lumpur, led by Dr. Go back in 2018.
Okay.
And it shows how prevalence can even differ within the same city. You've got different ethnic groups, different age groups, and the rates are all different. Like you see different rates amongst Indian, Chinese, Malay children.
Wow, that's a pretty big range.
Yeah, it is.
So what are the biggest reasons for these kinds of differences?
Well, the biggest one, and this is very consistent, is socioeconomic status during childhood.
Okay, so how well off you are as a kid.
Yeah, basically.
Okay.
But it's more than just money.
Okay.
It's about all the things that come with it. So hygiene, sanitation, how crowded the living conditions are, education levels.
So like the overall environment.
Exactly. And there's a really strong link there. Generally, the lower the socioeconomic status during childhood, the higher the chance of getting infected with H. pylori.
Makes sense.
Yeah.
So you see higher rates in developing countries,
Right.
in more resource-poor areas,
Exactly.
and also, I guess, explains why people who move from high-prevalence regions are often more at risk even when they move to more developed low-prevalence countries.
Yeah, it's about where they spent their childhood.
It's like it's baked in from childhood.
Yeah.
Okay, so it sounds like it's much more about where and how you grow up rather than, like, your genes.
That's right.
Okay.
It's much more environmental than genetic.
And what about age? Does your risk of getting H. pylori go up as you get older?
Well, the prevalence does tend to increase with age.
Okay.
But this is largely due to what we call a cohort effect.
Cohort effects.
Yeah, it's basically like people born a long time ago. They were much more likely to be exposed to conditions when they were kids that favored transmission compared to people born more recently.
I see.
So it's not so much about, catching it as an adult.
Oh,
Although that can happen, it's more about reflecting those early years.
So like when you grew up.
Exactly.
Okay. So are we seeing any changes in the infection rates over time?
We are, and this is actually a very important point. So many developed countries and countries that have experienced rapid economic growth, leading to better living standards, they've seen infection rates drop.
Infection rates drop.
Okay. Pretty dramatically, especially amongst children and younger adults.
So it's going down in those places.
Yeah. Overall prevalence now is quite low in those countries.
Makes sense.
And this decline is really driven by, improvements in hygiene, and sanitation across the whole population.
Right.
That's actually a much bigger driver of change than just treating individual cases.
Right, because, in most countries, you're only actually treating a small percentage of infected people, right?
Exactly. Japan is kind of the exception here.
Right.
They've actually implemented widespread screening and treatment programs for young adults.
Oh, wow. Okay.
So they're actively tackling it.
Actively tackling it, yeah.
Yeah.
So with fewer infections, does that mean we're seeing fewer diseases later on?
That's what you'd expect, right?
Yeah.
You would expect to see a decrease in things like peptic ulcer disease and non-cardiac gastric cancer, because generally these follow the prevalence of H. pylori in the population.
Yeah.
And actually in developed countries, we have seen the rates of these diseases going down over the last few decades.
Okay, that's good.
Yeah, it is good. But, and this is important, the decrease in these diseases, it kind of lags behind the drop in infection rates by many years.
Okay. So it takes a while to see the impact.
Yeah, it does. Unfortunately, in countries where socioeconomic standards haven't improved or even where they've gotten worse, prevalence of H. pylori seems to be stable.
Okay.
And we're still seeing a large burden of peptic ulcer disease
Right.
and gastric cancer in those populations.
So those problems haven't gone away.
Not yet.
Okay, so we've talked about how you get it, who's more likely to have it,
Hmm.
and the trends globally.
Yeah.
Now let's get into the impact.
Okay.
What kind of health problems can H. pylori actually cause?
Well, the big ones, like we mentioned,
Yeah.
peptic ulcer disease and gastric cancer, but it's also linked to some other issues.
Okay.
So starting with peptic ulcers, the discovery that H. pylori was the main cause behind most duodenal ulcers
Okay.
and a significant number of gastric ulcers,
Okay.
that was a huge breakthrough. I mean, that earned a Nobel Prize.
Wow. Nobel Prize worthy.
Yeah, it was a big deal. Now, while the proportion of ulcers caused by H. pylori is going down in developed countries, because of lower infection rates, and we're treating it better,
Okay.
it's still a major issue in less developed regions where infection is still widespread,
Right.
and treatment might not be as common.
Okay.
It's estimated that if you are infected with H. pylori, you have about a 15–20% lifetime risk of developing a peptic ulcer.
That's not insignificant. That's pretty high, really.
Yeah.
Okay, so what can happen if those ulcers aren't treated?
Well, untreated peptic ulcers can be a chronic problem,
Okay.
leading to pain, bleeding,
Yeah.
and even life-threatening complications like perforation.
So like tears in the stomach or the duodenum.
Exactly.
Okay.
And it's not just the health impact. It has economic impacts, too. People can't work. They need more medical care.
Right.
But the good news is treating H. pylori actually heals the vast majority of active peptic ulcers,
Okay.
and it prevents them from coming back.
So it's a cure.
Essentially, yeah. And also, it prevents future ulcers in people who've had them before.
So you're less likely to have more problems.
Exactly.
Okay. Now, I think it's important to remember, too, that NSAIDs,
Right.
like aspirin, ibuprofen,
Yeah.
they're also a major cause of ulcers.
They are.
And H. pylori and NSAIDs can actually act together
Oh, yeah.
to increase the risk of ulcers and bleeding.
It's like a double whammy.
Yeah. So in those cases, treating H. pylori, especially before someone starts long-term NSAIDs,
Mm-hmm.
it can really reduce that risk.
That's right. It's important to address both.
Okay. So ulcers, we've covered that.
Yeah.
What about the cancer risk?
Right. So gastric cancer.
Yeah, gastric cancer.
Yeah.
That's obviously a big concern.
It is a huge concern globally.
Okay.
So in some people who are susceptible
Okay.
and have this kind of long-standing inflammation of the stomach lining
Yeah.
due to H. pylori,
Okay.
the lining of the stomach can actually go through a series of changes over many years.
Okay. So like a progression.
Yeah, a progression.
Okay.
So you start with this chronic gastritis.
Okay.
And then in some people, you get loss of the glands in the stomach.
Okay.
Then the stomach lining can start to look like the lining of the intestine.
Okay.
That's called intestinal metaplasia.
Intestinal metaplasia.
Yeah. And then, in some cases,
Okay.
this progresses to abnormal cell growth.
Okay.
And eventually, in a small number of people, to gastric cancer.
That's good cancer, yeah.
Yeah. And unfortunately, gastric cancer, it's often not detected until it's at quite an advanced stage.
Okay.
And the outcomes generally are pretty poor.
Not good.
Right.
Yeah.
Even though the lifetime risk for an individual, it's relatively low,
Okay.
somewhere around 1.5 to 2.0% for someone who's infected.
Okay, so not huge,
Right.
but because so many people are infected globally,
Right.
the total number of gastric cancer cases is just huge.
Huge, yeah.
Yeah, we're talking over 1 million new cases each year.
And a high mortality rate. Like if you look at Table 1, it really shows you that.
Sobering statistics.
Yeah. And East Asia, especially countries like Japan, Korea, Eastern China,
Okay.
they have the highest rates. China alone accounts for something like 40% of all the cases globally.
Wow.
Yeah.
Are there other things besides just having H. pylori that contribute to this cancer risk?
Yeah, there are a bunch of host factors and, factors related to the actual bacteria.
Okay, so host factors.
Yeah, like smoking, that's a big one.
Smoking.
Diet plays a role, so high salt intake, lots of pickled foods.
Okay.
A diet that's low in antioxidants,
Okay.
those have been linked to higher risk.
Okay.
And then there are genetic factors too, like specific gene variations.
Okay.
Things like, polymorphisms in IL-1 genes and some of the pathogen recognition receptor genes.
Okay.
Those can play a role. And then on the bacteria side,
Okay.
different strains of H. pylori, they have different virulence factors.
Okay, so like how aggressive they are?
Yeah, exactly. And some of those, cause more inflammation. They're associated with higher cancer risk.
Okay, so it's not just about having the bacteria, it's about like what strain you have and these other factors in your life.
Exactly. It's complex. It's this interplay between, the person and the bug.
Okay. So if you could get rid of H. pylori early on, could you actually prevent gastric cancer?
Well, the evidence suggests that yes, if you eradicate H. pylori before those precancerous changes happen
Okay.
in the stomach lining,
Okay.
then you can indeed prevent gastric cancer.
Prevent it.
Yeah. And actually, that's the rationale behind those large-scale test and treat screening programs they have in some countries,
Okay.
for young adults,
Okay.
particularly in those countries with a high burden of gastric cancer and the resources to do it.
Right.
But obviously in less wealthy regions where gastric cancer is still a big problem,
Yeah.
widespread screening is more of an aspiration. It's not really practical at the moment due to cost, logistics, and, other healthcare needs.
Other pressing priorities.
Exactly.
Okay. What about if you eradicate it after some of those changes have already taken place?
Okay, so if H. pylori is eradicated after the stomach lining has gone through some changes,
Yeah.
it might still lower the risk of gastric cancer, but it doesn't eliminate it completely.
Okay.
The residual risk, that remaining risk,
Yeah.
it really depends on how extensive those changes were,
Okay.
how severe they are.
Okay.
And then all those other individual risk factors we talked about.
Okay.
So, in some cases where the stomach lining has started to resemble the intestine,
Yeah.
doctors might recommend regular endoscopic surveillance.
So like going back and checking.
Yeah, keeping a close eye on things.
Okay. And what about that malt lymphoma you mentioned?
Right, so gastric mold lymphoma.
Yeah.
That stands for mucosa-associated lymphoid tissue.
Okay.
It's a rare type of cancer.
Oh.
The good news here is that most cases are actually caused by H. pylori infection.
Okay.
And if it's caught early, eradicating the bacteria can cause the lymphoma to regress.
To shrink.
Yeah, shrink or even be cured.
Oh, wow.
Yeah, so that's good news, although in some cases it can recur later.
Okay. So it might come back.
Yeah, it's not a guarantee, but it can happen.
Okay. So ulcers, cancer, big concerns. But what about just like general stomach upset? Can H. pylori cause that?
Yeah, that's a really common question. So most of the time, actually, H. pylori gastritis, which is the inflammation of the stomach lining,
Yeah.
it doesn't actually cause any symptoms.
Really?
Yeah, but it can be associated with upper gut symptoms,
Okay.
even when there's no ulcer.
Okay.
But it's important to remember that only a minority of infected people who have what we call functional dyspepsia actually get long-lasting relief from their symptoms after H. pylori treatment.
So how many are we talking?
It's probably somewhere around a third or less.
Yeah.
And this is because functional dyspepsia is kind of it's an umbrella term.
Right.
It's a bunch of different things.
It's not just one thing.
No, there can be lots of causes.
Okay.
So H. pylori might be the culprit in some,
Okay.
but in others, it might just be present at the same time,
Okay.
but not actually causing the problem.
Okay. So it's not like a guaranteed fix for indigestion.
No, not at all. But even if it doesn't completely resolve their symptoms,
Okay.
people with H. pylori associated dyspepsia
Okay.
who undergo eradication, they're still more likely to see improvement compared to those just given acid-suppressing medication.
Okay.
And they might still get that benefit of reduced lifetime risk of ulcers and cancer,
Okay.
especially if they're treated before significant changes happen in their stomach lining.
Right. So the long-term benefits are still there.
Exactly.
Okay. What about all those other things you hear about being linked to H. pylori?
Yeah. You hear about a lot of things, right?
Yeah.
But the fact is, for most of those conditions,
Yeah.
there isn't strong evidence that H. pylori is actually causing the problem.
Okay.
When you have such a common infection, it's bound to show up in people with other conditions.
Right.
It's just statistics.
Correlation doesn't equal causation.
Exactly.
Right.
There could be other shared risk factors
Oh.
or just pure chance.
Okay.
But we need more than just seeing them together to say it's causing it.
Okay. So someone's having stomach issues and H. pylori is suspected.
Right.
How do you actually diagnose it?
So that's a really important step. And the guidelines really emphasize that you should only test for H. pylori if you plan to treat it if it's positive.
Okay. So there has to be a reason to test.
Exactly.
Okay.
There's not much point in knowing you have it if you're not going to do anything about it.
Makes sense.
And Table 2 in the guidelines, it gives a nice summary of all the indications for testing and treating.
Okay.
And obviously this can vary depending on the region.
Yeah.
but peptic ulcer disease.
Okay.
That's probably the most common indication worldwide.
Okay.
And that's been a well-established indication for years.
Okay.
You know, the benefits for treating this chronic condition with just a short course of antibiotics,
Yeah.
they're substantial both for health and for cost.
Okay.
So in regions with limited resources, you know, this indication should really be the priority.
Okay. So if you decide to test,
Right.
what tests are actually available?
So we have two main types of tests. You've got endoscopic tests, which are invasive,
Okay.
and you've got non-invasive tests.
Non-invasive.
So the endoscopic ones,
Yeah.
they involve taking biopsies during an endoscopy.
So they're going in with a camera into the stomach.
Right.
Okay.
And those biopsies are then used to look at the tissue under a microscope, which is called histology.
Okay. Histology.
And for a urese test, which detects an enzyme that's produced by H. pylori.
Okay.
And sometimes we also use biopsies to try and grow the bacteria in a lab.
Okay.
That's culture.
Culture.
So we can do antibiotic susceptibility testing.
So you can see which antibiotics will kill it.
Exactly.
Yeah.
And that's particularly important when there's a concern about resistance, which is becoming more and more of an issue.
Okay.
Generally, you know, the most accurate results come from taking samples from at least 2 different sites in the stomach.
Okay.
Usually the antrum.
The antrum.
Yeah, which is the lower part.
Okay.
And the body.
The body of the stomach.
Yeah, and using at least 2 different testing methods.
Okay.
So you could do like histology and urese testing.
Okay.
And there are also structured ways of taking biopsies, which can give you even more information.
Okay. What are some of those ways?
So you've got things like the OLGA system or the old gym system.
OGA? OLG?
Yeah, they're basically systems that doctors use to get a